It's something Alberta Premier Jason Kenney has said Alberta is not going to try and do, getting to COVID-Zero. But a group of medical professionals say with the rising numbers of variants of concern, drastic measures are needed, and a 7 to 8 week lockdown might be what we need to stop the virus in its tracks.
To try to prevent a third wave, because we just don't think that we can handle this both mentally and physically, because all of us are just very burnt out at this point.
ER Dr. Shazma Mathani is concerned about what the next wave of COVID-19 could mean for the mental health of the medical front line.
We don't do something to stop this and put a stop to this, the variants are likely going to make this third wave even worse than the second wave.
This past week, hospitalizations have started to trend upwards. And while Alberta has not released modeling on variant cases, this developmental biologist did her own, saying we're doubling case numbers every 7 days, much faster than in the fall.
Basically, we can either stop it now by financially supported lockdown, or we will need a harsh, much stronger lockdown at the end of April.
I myself am feeling it. I dread doing these interviews because I'm the person who tells everybody to, tells them what they don't want to hear.
ICU Dr. Darren Markland says we already know what to do. Social distancing, hand washing, staying home when sick, and not lifting restrictions too soon. Well, he would like to see a COVID-Zero strategy. He doesn't see the political will in Alberta. Even the opposition NDP is not calling for it.
What I'm looking for as reasonable middle ground is just let's settle down. Let's enjoy our spring and summer as things warm up. Let's continue to do the things that we did last summer that didn't get us in trouble, and let's get vaccinated as quickly as possible.
Is to follow the public health measures every day and every activity we do, because what we are seeing is that the variant is spreading widely in locations where people are not following the public health measures and where they've let their guard down, and that variant takes the opportunity.
Because like Vietnam, Laos, and I think Cambodia.
Those behind the push for COVID-Zero in Alberta argue that the yo-yo of restrictions and anxiety is causing more harm than following similar paths as New Zealand or Vietnam.
Mental health is suffering because of the restrictions, and I don't disagree with that. But I do believe that mental health will suffer tremendously more if society enters a place where the environment is unsafe yet again, and if the hospital and health systems do collapse.
Reminding that studies have proven COVID-19 disproportionately impacts already vulnerable sections of society, lower income, immigrant, or those dealing with addictions. Saying if we shut down now with economic supports, it might be enough to vaccinate the population and get rid of COVID-19. From Edmonton, Carly Robinson, City News.